Culturally competent nursing. Please explain a little bit more about this project. What is it about?
Culturally Competent Nursing and Evaluation Plan is a resource that I developed primarily because I wanted nurse educators, nursing students, and even nurses who are licensed and already working in within the profession to have a resource to deal with and address issues of racial discrimination and even explore their own personal biases so that we make sure that we are providing quality care to culturally diverse patients.
When did you decide to do this project? I mean, what's the reasoning behind it?
So when back in 2015, I had submitted an essay titled Patient Self-Management Impact of Racism Related Vigilance in Hypertensive African Americans. So essentially the essay was submitted by my professor to the school's library. And then it was published on their digital library. So you can access it through the university's digital library their website. And essentially the book was, the essay was looking at addressing a chronic condition such as hypertension and how culturally competent nursing and culturally competent healthcare professionals in general can really address health disparities by looking at their own personal biases. And so we think about something like hypertension. We know that hypertension is a chronic condition that is largely due to stress. There's other components, but all of those components are components that African Americans, Black people in general, but African Americans specifically, as it relates to the United States healthcare system, are often at risk for. So, for example, African Americans are at high risk for poor outcomes in health literacy, living in food deserts. So, those are just two. Even something as simple as maybe there's an issue around physical activity because of the neighborhoods, for example. Not saying that all African Americans live in dangerous neighborhoods, but the ones who do are more often and are higher risk for having issues related to hypertension and cardiovascular disease. Now, this is something that the research is has supported. So, with consideration of all of these factors, I'm addressing a lot of that in this resource as factors that influence the health outcomes of African Americans who are at high risk for this kind of hypertension that is largely due to stress that is due to toxic environments and toxic living conditions and also racial discrimination.
I see within your workbook you applied, some of these research models. Explain a little bit about the evaluation and assessment tools.
The evaluation and assessment tools are actually in the appendix of this resource. So if you purchase this resource and you go to the appendix, you'll see a discrimination survey, cultural competency self-assessment, and that's a self-assessment that um, students can actually use to actually think to reflect on their own personal biases. There's a self-reflection assignment that students can actually use following their clinicals. Um, that's usually the time where you see nurse instructors and students communicating about how the day went, what are some things they learned that day. And so I think that would be a great opportunity to actually have students really reflecting on their clinical learning experience. There's also a cultural competency curriculum questionnaire. This questionnaire is primarily for the nurse educators and also for anyone who is in a nurse leadership role or managing nursing activities to really look at ways to improve teaching strategies to ensure that we are actually promoting the attainment of cultural competency. There's also a clinical evaluation tool. I'm really excited about this evaluation tool because it actually measures competencies and the attainment of those competencies. And so it's really a great resource. There's a copy of a version on the website www.acd4n on the event page. If you go on the event page and you scroll down to the section that's talking about this resource, you'll actually see an outline of the American Association of Colleges of Nursing, 5 key competencies for cultural competence. Their competencies, I actually developed, and the evaluation, the competencies in that evaluation. So if you view that, I think you'll get a really good idea of the kind of detail that's in the evaluation tool. It has the same structure as the one that's in the resource, but the one that's here in this resource is not from the American Association of Colleges of Nursing. It's actually core competencies that I developed based on my research. And then also the cultural clinical case study care plan rubric. I know that's a mouthful, but this is a rubric that actually is really helpful for nurse educators who are looking for assignments or ways to actually measure if nursing students are comfortable creating care plans that are culturally congruent. And there's also a nice timeline for implementation for a curriculum revision process. And it's very detailed. It has a time, dates. It has responsible parties, expected outcomes. So it's a really clear outline. And also there is a workshop activity. So, which is built into the timeline. So it's referenced in the timeline, but it's outlined here in the appendix. So great resource for nurse educators, nurse leaders, someone in public health. Again, licensed nurses who are seasoned licensed nurses, have been nurses for years, and they're still struggling with how we can better address issues related to cultural competencies, racial discrimination, personal biases. Also, for nurses who are advanced practice nurses, that could be anyone from your nurse practitioner or anyone in healthcare, really, who is in a leadership role, who wants to really address these issues and improve things. Actually have this resource set up for them, and I'm looking forward to people to use the resource and to give me feedback. How's it working for you? What do you plan on doing with this information that you attain through this resource?
Well, I'd just like to take the opportunity to thank you for your time, Ms. Alston.
Mhm.
This was a very comprehensive and informational workbook for, like you said, the learner and the educator. Any final words?
So I know I shared a lot, but one of my goals is really for healthcare professionals to really put that mirror up and really look at themselves and look at issues where we can really improve the way we teach and prepare the young minds of those who are entering into the profession, or even older, adult learners who are entering in the profession. We want to ensure that these individuals are not going into the healthcare picking up what I would like to say bad practices, you know, stereotypes, ideas that we're bringing in from the outside into our patient care interactions. It's going to happen. It's natural. It's a normal part of our interactions that some of those, I guess, our own personal biases, they enter into that clinical space, they enter into that patient interaction. But we need to make sure, as leaders in healthcare, as educators, to really model the right behaviors. And the only way we can do that from a educator standpoint is in the classroom. From a leadership standpoint is what we do as far as modeling the right thing to do. And we can't do it if we're not honest about what we're dealing with personally. So if you're dealing with issues of your personal biases, your own discrimination and stereotypes that enter into the clinical space, if you're not dealing with that, then you're not going to be able to identify that in someone else. And if you are dealing with it, you can better identify it in someone else and really model the right behavior. And that's what this is really about. It's really about changing things and modeling the right behavior.
Yes. And once again, this is a very recommended and worthwhile read. Thank you once again for your time.
Thank you.